think many mechanisms in place for when people might return based on the fact that they've been cleared by the test?
Yeah. First of all, to address the first point you just made, obviously I'm not out and about every day, but I did fly to and from North Louisiana yesterday over some of our major highways. I did see more traffic than, quite frankly, I expected to see or wanted to see. And what your observation is consistent with what I'm being told by other people. For example, when they come to work here at GOSEP, they're seeing more traffic every day than they were seeing before. And we also have some social distancing apps now that are kind of assigning letter grades. And we weren't doing particularly well to begin with. I think our state was graded at a C or a C minus. I believe we moved down to a D most recently because they're using the GPS data in people's phones to kind of measure what the movement is. And that's why I'm trying to make sure that people understand that COVID-19 remains in every community. It is obviously fatal for a number of people. We're reporting on these deaths. People are contracting this disease and continue to spread this disease. And so it's important that people follow all of the precautions that we've been giving them, whether it's the order to stay at home, whether it's the hygiene, the social distancing, all of those things. It's incredibly important. I will tell you this. If you look at the efforts that have been made in Louisiana to increase our testing, they have been tremendously successful in the sense that we are administering more tests per capita than any other state in the nation. Very helpful. The worst thing you want to do is not know what you're dealing with. And now we can say that we have testing in every single region of the state. Every parish of the state has testing available. But we're not satisfied. We're trying to expand on the testing that's available for surveillance purposes, for diagnostic purposes, and for detecting the presence of the antibodies through serology tests. Now, these things are coming online now, and we have to make sure that they're approved and that they're effective and reliable and so forth. But I will tell you, the key to moving forward, especially between now and such time as a vaccine becomes available, will be through very aggressive, robust testing in all three of the categories that I just mentioned, plus contact tracing, so that when we get back to where we can remove some of these restrictions and start to open up our economy, you're going to see a lot more testing, and the test results will inform our decisions, and not just about who can potentially go to work and so forth, but as we start seeing, if we start seeing a spike in testing, we may have to ratchet back down and put in place more restrictions too. And so what we don't want to do is go right back to that place where we've been trying to avoid. And so testing plays a big role in all of this. It's a big part of Dr. BU's day, is coordinating the testing around the state, but also looking to private sector testing capacity and working with our federal partners to maximize the tests that are available here. Because while I salute him and I thank him and his team for their good work, and really, you should know that over 90% of the tests that are coming in every day now are coming from commercial labs. And so we have healthcare providers. These hospitals are really stepping up. These FQHCs are really stepping up. The GOSEP here is going to start running the drive-through testing at the Hilario Center and so forth. We have Walmart with drive-up testing now. All of it is incredibly important as we move forward, and we're going to continue to bring more testing online and not less testing. And I don't know if you wanted to add anything to that, but that really is going to be key to us going forward. And I think you hear Dr. Fauci say this quite often as well.